The race for personal protective equipment. California has a wide-ranging agreement to buy PPE for its medical workers, and Governor Gavin Newsom signed this deal, reported to cost nearly $1 billion, and he did it out of a frustration, he said, with the federal response. A Department of Health and Human Services report this week echoes urgent calls from hospitals for more supplies. One administrator cited a 3 to 6 month delay for essential items, including those critical N95 face masks. Our Dr. John LaPook looks into the PPE supply chain.
We don't have enough. You know, I mean, it's one N95 mask for the entire shift.
One night recently, there was only one gown on the floor.
Every day when I go to work, I feel like a sheep going to slaughter.
These are the battle cries of doctors and nurses on the front lines fighting coronavirus without the proper armor.
This right here is my N95 mask that I will be wearing for the whole day throughout my shift.
But how did we get here, where healthcare workers have to fight for PPE so they can fight the virus without getting infected themselves?
We are all shopping China to try to get these materials, and we're all competing against each other.
A large portion of the U.S. PPE supply, like gloves, gowns, and masks, comes from China. Prashant Yadav is a senior fellow at the Center for Global Development and an expert on supply chain management.
But I think of about the 2 billion, let's say, N95 respirators that we would use, at least half or more comes from China.
2 million or 2 billion?
2 billion.
And is that each year?
Yes.
As coronavirus cases rose in China earlier this year, Yadav says PPE production took a hit, even as demand for it spiked. Large supply distributors told U.S. hospitals it could be months before their orders were met.
The links in the supply chain have been broken. Federal stockpile almost depleted. State-level stockpiles hold limited supplies, and distributors not being able to deliver N95s in any significant quantity for 3 to 6 weeks.
States and the federal government stepped in to help find and buy PPE, but that's led to bidding wars.
It's like being on eBay with 50 other states.
States are competing against states right now. That's no secret.
We're all competing against each other. States one against another. Federal government competing against states.
President Trump has insisted he is sending states what they need.
Since last Sunday, cargo planes have delivered almost, listen to this, 300 million gloves, almost 8 million masks, and 3 million gowns.
A Department of Homeland Security official told CBS News the strategic national stockpile of protective gear is almost depleted. Last week, President Trump invoked the Defense Production Act, ordering private companies to help manufacture ventilators and N95 face masks. But it could still be weeks before hospitals get the PPE, and donations aren't always enough.
The nation isn't ready to provide medical care in large catastrophes or big epidemics of contagious disease.
Experts have said for years, if a global pandemic were to hit, the U.S. may not have enough PPE.
Public health is about overplanning.
Beth Cameron ran the White House Pandemic Response Office under the Obama and Trump administrations. It was dissolved by the White House in 2018, and she believes that move left the country less prepared.
I'm really worried about the competition between states. It's the thing that keeps me up at night right now. I think that in the absence of a unified federal plan, states don't have any choice but to be prepared for their constituents.
In your opinion, what entity is best prepared to do that kind of unified plan?
I'd like to see a logistics czar at this point, to be honest with you, in my opinion. And I think that logistics czar could come from the military or could be a former military commander. We were going to need a plan for moving and sharing medical equipment across the United States. And I hope that we don't need to use that plan. But I think if we have that plan, we're not going to regret it.
For those on the front lines, it's a matter of life or death.
If we did have enough PPE, we wouldn't be forced to use the N95s over and over again.
We can't do our jobs effectively if we aren't safe. We're not safe, and therefore you're not safe. And so if you don't have healthcare workers, you cannot save lives.
You've heard that they've had to reuse the N95 masks because they're such precious commodities. And that's led medical centers across the country to try to figure out ways of repurposing them, of sanitizing them. But like so many other things in this outbreak, we're trying to figure it out on the fly as we go. Tony?
Yeah, John, we're definitely in whatever it takes territory with this crisis. Thank you very much.